This abdominal exercise is called square press. It's purely a core exercise which will challenge core stability. So, going to be lying supine on your back with both knees bent and arms gently down by the sides of the body. Engage the core, pelvic floor, belly button, and float one leg up at a time until both legs are in tabletop position above the hips. The feet and knees are adducted together with the knees directly above the hip. Now you want to keep a 90-degree angle. So as the thighs push away, make sure that your legs don't straighten, changing the angle here, and make sure that the heels don't come close to the butt, changing the angle here at the knee joint again. So keeping that 90-degree angle. Gently arms down by the side. You breathe in to prepare. Exhale, engage pelvic floor, belly button, and then push the thighs away from the hips, from the midline, and gently pushing the feet towards the floor. Only push the thighs as far as a stable pelvis, whether that's a neutral pelvis or imprinted spine, can be maintained. Then you open out to about shoulder width apart, then really slowly come back, pressing that low back down, either in a neutral or imprinted position, just making sure it doesn't arch, and then you close the feet back down again. So effectively you're making a square shape. Legs go down, legs go out, legs come back, and then they come together. So the range of movement is only dictated by where you can keep a stable pelvis. Okay, so let's show you from the back. So head here, lying on your back there, Jasmine. So the arms are just down by the side, and engage the core, pelvic floor, belly button. Float one leg up in the air at a time until you reach that tabletop position where the feet are level with your knees and the knees and feet are adducted together. So I'm going to place my hand just underneath that lumbar spine here just to make sure that there's no change in pressure. So Jasmine's in a neutral position. So if she's chosen to start in neutral, it should remain in neutral. If she's chosen to imprint the spine and press that lower back to the mat, then I'd be looking for that position to be maintained throughout as well. Okay, so from here, take a deep breath in. As you exhale, engage pelvic floor, belly button, and push the thighs away from the chest, the feet heading towards the floor only as far as you can maintain a stable pelvis. And then gently open the feet and the knees to shoulder width, no wider, not too wide. Make sure that back is down before you slowly bring the knees back. Don't rush this part. And then gently close the legs back again. So 4 movements there. Again, breathing in, exhale, pelvic floor, belly button, pushing the legs away, 2, 3, 4, open, 2, 3, 4, slowly back, 2, 3, 4, and close, 2, 3, 4, okay? So a slightly easier version would be with one foot on the floor, so just keeping some stability with this foot down on the floor. So here, exactly the same action. Take a breath in. Exhale, engage pelvic floor, belly button, pushing that knee down. So this bit's going to be easier than pushing 2 straight legs away, but you've got to watch this bit where you open the leg out to the side, because this bit's actually harder because you've only got one leg opening out to the side. One of 2 things might want to happen. The pelvis might rotate with the weight of this leg, or this knee will also come out to try to compensate and balance. So you've got to make sure that this knee is pointing up to the ceiling and you only open that leg out as far as you can keep this opposite hip down. Then the leg comes back and then it comes in. So the first bit, this bit going down, is easier than when you've got 2 legs in the air, but this bit is actually harder. So a bit more obliques on that version, and then slowly bring the leg back in. And then back to the center. Now lift this leg back up, and just one last version with the arms in the air, because when the arms are down you can gently press into the floor for some stability. So if we take away that stability, and then same version, breathing in, exhale, pelvic floor, belly button, pushing away a little, opening out, Slowly returning, don't rush this return. And then back. And one last version. Now, as the legs push away, the arms are going to push the opposite direction. Now, the arms pushing back will make the ribs flare. It will also make the shoulders hunch. You've got to work harder in the core to keep the ribs down as well as the pelvis, and also those scapular stabilizers, the lower trapezius. So breathing in, exhale, pelvic floor, belly button, push the arms backwards. Again, only as far as a stable pelvis allows, then open the knees. Bring the legs back, bring the arms back. Good. And then close the knees. And when you're ready, place one foot back down on the floor at a time. And that's your square press.